treatments for your asthma.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse briefing colleague about a patient admitted with chest pain and shortness of breath. Now read the question.
Hey, can I give you a quick update on Mr. Smith's condition?
Sure, what's going on with him?
Well, he was admitted yesterday with chest pain and shortness of breath. We did an EKG and it showed signs of a possible heart attack.
Oh no, that's serious. Is he being treated for it?
Yes, he's currently on a nitroglycerin drip and we've also started him on aspirin and heparin. The cardiologist is scheduled to see him later today.
Okay, that's good. Is he stable?
His vital signs are stable and he's been resting comfortably. He's also had some mild nausea, but we've given him some medication for that.
Alright, thanks for the update. I'll make sure to check on him later.
Sure thing. Let me know if you need any help with him.
Will do. Thanks.
Now look at question 26. You hear a senior nurse advising a trainee about the treatment plan for our patient with diabetes. Now read the question.
Hey, can I talk to you for a moment? I noticed you were having some trouble understanding the treatment plan for our patient with diabetes.
Yes, it's a bit overwhelming. Can you explain it to me again?
Of course. Diabetes is a chronic condition that affects the way the body processes blood sugar. Our patient needs to monitor their blood sugar levels regularly and take insulin as needed to regulate it. They also need to pay close attention to their diet and exercise regimen to keep their blood sugar levels under control.
I see. So it's a lot of self-management on the patient's part.
Yes, it is. But as healthcare professionals, it's our job to educate and support them in managing their condition. We need to make sure they have the resources and knowledge they need to take care of themselves.
That makes sense. Thank you for explaining it to me.
No problem. And if you ever have any other questions, just let me know. We're here to help each other out.
I will, thank you. Now look at question 27. You hear a senior nurse talking about a new telehealth program that has been introduced on the ward where nurse work. Now read the question.
I wanted to share some exciting news with all of you. We will be introducing a new telehealth program on our ward.
What is telehealth?
Telehealth refers to the use of technology to deliver healthcare remotely. In this case, we will be using video conferencing to connect patients with specialists who are not physically present on our ward.
How will it work?
Patients will be able to have virtual consultations with specialists and receive care and treatment plans without having to leave the ward. This will not only save time and resources, but it will also reduce the risk of infection for our patients.
That sounds like a great idea. How will it benefit our patients?
Telehealth will give our patients access to a wider range of specialists and improve their overall care. It will also allow patients in rural or remote areas to receive the same level of care as those in urban areas.
How will we be trained on this new initiative?
We will be conducting training sessions on how to use the video conferencing equipment and software, as well as on how to prepare patients for their virtual consultations. We will also be provided with a detailed guide on how to implement telehealth on our ward.
When will this be implemented?
We are planning to launch the telehealth program in the next few weeks. We are currently finalizing all the logistics, but we will keep you all informed as we move forward.
Thank you for sharing this with us. We are looking forward to working with this new program.
Yes, I believe it will greatly benefit our patients, and we are excited to be part of this new initiative.
Now look at question 28. You hear two healthcare professionals talking about virtual reality rehabilitation technology in their healthcare profession. Now read the question.
Hey, have you heard about the new technology that's being introduced in our field?
No, what is it?
It's called the virtual reality rehabilitation. It's a new technology that uses virtual reality to help patients with physical rehabilitation.
That sounds interesting. How does it work?
It uses virtual reality headsets to create immersive environments where patients can perform exercises and simulations that mimic real-life scenarios. This helps them to improve their balance, coordination, and overall physical function.
That's really innovative. How effective is it compared to traditional physical therapy methods?
Studies have shown that the use of virtual reality technology in physical therapy can lead to improved outcomes and a faster recovery time for patients. It also makes the therapy sessions more engaging and motivating for patients, which can lead to better adherence to treatment plans.
That's great to hear. How do we access this technology?
The technology is currently being rolled out in selected hospitals and clinics. We can contact our supervisor to find out more about how we can access it for our patients.
Thanks for sharing this with me. I'm excited to learn more about this new technology and how it can benefit our patients.
Yes, it's a game changer for our profession, and I can't wait to start using it in our practice.
Now look at question 29. You hear a chiropractor briefing a colleague about a patient with complaints of chronic lower back pain. Now read the question.
Hey, I wanted to brief you about a new patient that I just saw at my practice. The patient is a 25-year-old female with complaints of chronic lower back pain. She has a history of a car accident that occurred a few years ago, and she has been experiencing pain ever since.
How did you assess her condition?
I performed a thorough physical examination, including a range of motion test, muscle strength test, and neurological test. I also reviewed her medical history and any imaging studies that were available.
What did you find?
I found that she has limited range of motion in her lower back and muscle weakness in her core and gluteal muscles. I also found some nerve irritation and a misalignment in her lumbar spine.
What treatment did you recommend for her?
I recommended a course of manual adjustments to realign her spine, along with a series of exercises to strengthen her core and gluteal muscles. I also advised her to use heat therapy and take anti-inflammatory medication to manage her pain.
How did the patient respond to the treatment?
She was quite pleased with the treatment. She reported a significant reduction in her pain and an improvement in her range of motion after just one session. We are going to continue her treatment, and I will be monitoring her progress.
That's great to hear. Thanks for briefing me on this patient.
Of course, I just wanted to give you an update on how this case is going so far. Keep in mind that every patient is different and we need to approach them with care and attention.
Now look at question 30. You hear a pharmacist talking to a customer with a headache. Now read the question.
Good morning, how can I help you today?
Hi, I'm looking for some advice on over-the-counter pain relievers. I have a headache and I'm not sure which one would be the best for me.
Of course, I'd be happy to help. Can you tell me a bit more about your symptoms? Are you experiencing any other symptoms besides the headache?
No, just the headache. It's been going on for a few days and it's quite bad.
Alright, based on what you have told me, I would recommend trying ibuprofen or naproxen. These are both non-steroidal anti-inflammatory drugs, NSAIDs, and they are effective in treating headaches as well as other types of pain.
What's the difference between the two?
Both ibuprofen and naproxen are NSAIDs, but they work slightly differently. Ibuprofen is a shorter-acting drug, so it's best to take it as needed for acute pain, whereas naproxen is a longer-acting drug and it's better for treating chronic pain.
Oh, I see. And what about side effects?
Both ibuprofen and naproxen can cause stomach upset, so it's best to take them with food. It's also important to stay well hydrated when taking these medications. If you experience any severe side effects or allergic reactions, you should stop taking the medication and contact your healthcare provider.
That's helpful. I'll definitely consider trying ibuprofen or naproxen. Thank you for your advice.
You are welcome, I'm glad I could help. Remember that it's always best to consult with your healthcare provider before taking any medication.